Hi, I'm Steve Adubato. Thank you so much for joining us. For those who know our program, you know that we've been promoting and creating more public awareness around organ and tissue donation for many years now. We're taping on the 16th of February, organ and tissue donation more important than ever before, particularly a year plus into this COVID crisis. We're joined now by Alyssa Diadio, who's the Director of Hospital and Community Services at the New Jersey Sharing Network, which is New Jersey's organization committed to organ and tissue donation. Well, it's great to have you with us.
Thanks so much, Steve.
Before we even get into the impact of COVID on organ and tissue donation, your personal connection, your personal experience to this, and it's not an issue, it's a cause, is so powerful. Talk about it.
So a lot of people say to me, what got you to the Sharing Network and working here for 10 years plus? And what did that is my dad. In 2009, I was driving back to school after an Easter break with my parents. I'm an only child, big Italian Greek family. We had a great holiday, and I got a call abruptly from my family that my dad suffered a brain hemorrhage. My dad was 50 years old, went to the gym every day, was our Superman, very involved in the community, sports. You definitely wouldn't think that this would happen to him. So it was sudden, it was tragic. After days spending in the hospital, hearing from doctors and the nurses that he wasn't gonna make a meaningful recovery, we were approached from the Sharing Network and given the opportunity for organ and tissue donation. And I say often it's an opportunity because in a moment of no control over bringing my dad back or having him back in our lives, we were given an opportunity to save someone else's life and give a family back their loved one. So we said yes right away. My dad went on to donate both of his kidneys, and his tissue has gone to over 100 people throughout the United States. So I can say as a mom now myself, I am very proud to tell my grandchildren that, one man wrote us a letter and said, I'm able to be with my grandchildren because of your father. And I wouldn't have that without him. So as a mom able to look at her grandchildren and say, your grandfather's a hero and this is what he did, I couldn't be prouder of him.
It's such a powerful story. And because we've been working with the Sharing Network for so many years, there are personal stories like that. And by the way, log on to the Sharing Network website. Our team will put it up as we speak right now. Let me ask you this. We're taping, as I said, on the 16th of February, be seen after that, a year plus into this pandemic. What impact, from your experience heading up hospital and community services for the Sharing Network, what impact has COVID had on organ and tissue donation?
I think the first thing was there was no rule book for anybody of how to handle this. For whatever business or company or cause you were in, there was no rule book. So we had to first figure out how to keep our staff safe while maintaining the hope that we have for the over 4,000 people that are waiting for a life-saving transplant in New Jersey and the over 110,000 people that are waiting across the country.
Do those numbers again, if you could, Alyssa, because they're just striking.
Yep, 4,000 in New Jersey and 110,000 in the United States. And these are people where we know how to make them better. It's not, there's a cure for this, right? And it's transplant. So how do we still provide them hope? And then the other side to the coin, which many people were going through, is they can't be with their loved ones in the hospital. So how do we talk to families about donation that can't even see their loved ones in the hospital because of visitor restrictions? So it was about keeping our staff safe, giving hope to the people waiting, and then how do we connect with these families and provide them support during the worst time of their lives, and plus a global pandemic on top of it.
Wow. Your personal connection speaks for itself, but let me ask you, because there have been so many events, there's a walk, there's a run, there are so many gatherings and events that raise money and raise awareness that the New Jersey Sharing Network runs. Many of them are being done virtually right now. Connecting virtually, getting the message out virtually, for people who say, why don't we just put off this organ and tissue donation thing until, quote, after COVID? Why doesn't that approach work for those who are waiting?
Yeah, the need is now. And I think time is of the essence. These these people are suffering. And I think they needed to know that we were working. The Sharing Network never shut down 24 hours a day, whether it was our clinical department or in public education in our foundation, trying to reinvent the way we do things and the way we connect with people. We were hosting a lot of panel discussions that would stream through social media to try to engage the community. And we actually saw a 14% increase in the National Donor Registry during this time.
Tell folks what the donor registry is, by the way.
You can go to NewJerseySharingNetwork.org and register to be an organ donor through the National Registry. That's separate from the motor vehicle. However, it's the same purpose. The good thing
Explain that to folks as people go on the website right now, and our team will put it up. Explain the registry, National Registry, donor registry versus you get your license, et cetera, et cetera. Explain that.
So the National Registry would be a one-time sign up. There's no renewal, like when you go to the motor vehicle. As a New Jersey resident, when you renew, you need to say yes again. It doesn't carry over necessarily when you say yes to organ donation. So the great thing about the National Registry is you sign up once and your wishes are known and they're there, your decision is made. And you can also share that decision with your friends and family using the email feature at the end. So we do encourage people to go to the National Registry because it is a one-time deal. You do it and you're done.
And by the way, we're going to be joined at another time by Justin Johnson, who is Director of Clinical Services at the Sharing Network, to talk about the front line, because he's on the front lines, talk about that experience of a frontline healthcare worker. Alyssa, is there a message you want to deliver in the few seconds we have left to all those watching right now? What's that message?
I think the message is when you're home with your family and you have time to be with them, I think bring up the topic of organ and tissue donation. I understand that it may not be an easy one, but it's an important one. Make your decision known to them, register. And the other thing the Sharing Network will never do is we'll never stop honoring our organ and tissue donors and their families. That's our top priority always. They're our heroes. So we're so thankful for them.
So to Joe Roth, Annalise Glenn, and the leaders at the New Jersey Sharing Network, we thank them and the entire team so much. Thank you so much, Alyssa.
Thank you so much for the support, Steve. We appreciate it.
You got it. We're right back after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Healthcare Foundation of New Jersey, Delta Dental of New Jersey, the Northward Center, NJM Insurance Group, the New Jersey Education Association, the Fidelco Group, Fedway Associates, Inc., Georgian Court University, and by the Adler Aphasia Center. Promotional support provided by NJ.com and by NJ Biz.
NJM Insurance Company has been serving New Jersey policyholders for more than 100 years. But just who are NJM's policyholders? They're the men and women who teach our children, the public sector employees who maintain our infrastructure, the workers who craft our manufactured goods, and New Jersey's next generation of leaders, the people who make our state a great place to call home. NJM, we've got New Jersey covered.